where Ardent was and where it needed to be with hospital-acquired infections, patient safety indicator events required near immediate attention. And what that boiled down to was, getting to a committed set of interventions, but more importantly, a committed approach towards routine outcomes analysis. Event analysis down to any single infection. When you have your unit directors, your unit managers actually doing the cause analysis, and I don't mean like a root cause analysis, but the cause analysis when you have a deviation in care. All of a sudden you start finding out like, wow, we weren't able to do a chlorhexidine bath on a patient with eclampsia because the PAR values for chlorhexidine wipes were wrong. I mean, unless you take the time to get into what led to an operations failure, because that's what it is. It's almost never a single point failure. It's usually something embedded in your operations that are leading to the fallout. You get the results you have because you're exquisitely designed to get the results you have. If you don't like your results, you got to change the design. You won't know what the design change should be unless you have your managers actually getting into on their own for their unit, because they own that unit, what's driving your failure mode. So
in your reporting quality and safety events, you've put processes in place to teach your unit charge nurses or whoever's responsible for that unit to report up the events around that.
We have a whole structure around specific event analysis for all the HAIs and all the PSN-IDs.
Yep.
And that's the kind of thing where, some degree of centralized effort becomes helpful. I mean, they're the customer. And I know that sounds incredibly cliche. We are as valuable as we're giving them products that make them easier to execute and get the clinical outcomes that they need. So, that was a key area. COVID really did lead to, I think, some positives out there. We as an organization become much more effective as a multidisciplinary organization so that we could make rapid cycle changes. Our former operations weren't nearly what we needed to be. We became far more entrepreneurial. We became much more willing to, with adaptation, try, experiment, fail, adapt, try again, succeed. One of the things that we were really concerned about is that we could lose that along the way. We've been able to really retain that, if you will, multidisciplinary effort. We had clinicians who learned more about operations and operators who became more clinical. And the nexus became, we had clinical operators, and we have worked hard to retain that. So at least from a clinical and operations perspective, did we become a better organization coming out of COVID? We did, and we needed to be. So another area of my attention is making sure that we don't lose that. So I'm very proud of that. And I would say the third area that actually gives me comfort is that our sponsors, our board members really are not putting their heads in the sand. They see the change that's happening with Medicare. They see that the change that's happening in the payer landscape. They realize that we're going to have to evolve as a healthcare system to, again, achieve desired clinical outcomes without relying on acute care facilities. And they're not shying away from it. Is that will be disruptive to business models. And not only are they embracing it, they're encouraging us to embrace these changes as opposed to just simply be afraid of them.
Yeah. Ardent is not only a for-profit health system, but you're private equity backed. What are some of the benefits that's come with?
Technically speaking, EGI is a family fund.
Okay.
Here's a key benefit. They're in it for the long haul. They like to make very strong companies, some of which they hold for a very long time.
Generational investments.
Which would be different than, let's say, the time horizons for venture capital or private equity. They concentrate on where a company needs to get to in the long term to achieve the successes that they're looking for. They pride themselves as an organization on how well they can understand and control risk. And so long as a company is bringing good returns, the more they have the ability to understand the company, well, by definition, they're going to be a better ability to understand the risks for the industry and the risks for that company. So that's a huge advantage in terms of stability for our funding. Having a stable sponsor is a decisive advantage for Ardent.
Earlier this year, you guys announced the launching of Innovation Studio and partner with Switchpoint Ventures. Tell us a little more about that.
One of the things that we've appreciated as we started understanding the shift towards more of the care that we're going to have to provide outside of the hospital, we became much more connected to startup companies. And to me, there are various stages in working with a startup company's product, even some larger company products. It's defining a problem. It's a design to intervene on that problem. And inherently, if it's technology or service, it's the actual creation of a minimally viable product. And that's when we would often get contacted, after you had that minimally viable product. And that's where the question was, hey, help us further develop this. And development would mean further refine components within the actual service or technology of itself. But that's also further refine, well, how should it be deployed? And what people should be using this? And what processes should they use? And yes, the cliche of people, process, technology. But for many people who are developers, what they don't have access to would be the people. And they'll have a concept of how people should deploy that new technology or service, meaning what the process should be. But it's theoretical until it actually gets into the environment and becomes actual. So a huge part of what we have to do is be the developer. We just didn't really realize that was our role until, and you heard me describe, so many of our strategic partners needed us to serve in that space, which is why, candidly, once we started realizing we are a developer, that then we needed a joint venture with them. And that joint venture takes a form of equity, if you will. The reality was, for some areas, we began to think, now, wait a minute, especially as we are routinely getting offers for, come work with us, come work with us. We're realizing, they're not that far along. And considering now we have an understanding of how much development we do, and it's not just developing the people, process, technology, it's then creating the scale. That, well, what is actually out of our reach? We certainly can define the problem. On some level, we could probably even help with the design, but we can't make a minimally viable product. And that's where Switchpoint came in, and the joint venture we formed with Switchpoint, now in the name of Corion, to actually fill that gap. So Ardent has switched from 3 years ago, we can't be a development company, to now we certainly are becoming a development company. And it's mainly because, as we see, especially in the AI space, as we see just the sheer volume of pitches coming our way and how similar the products look, it's like, no, wait a minute. How far away are we from actually doing this on our own? And we've had some initial success with that. And we're realizing if we make a deeper commitment to it, candidly, the margins we'll make will simply be better.
Yeah. Well, and just to open that up a little bit, so say there's a challenge, there's multiple solutions, and you have a handful of companies coming to you with similar solutions for the same problem. How do you guys identify, okay, here's the one we're going to hitch our wagon to and do a pilot? Or?
Well, it doesn't necessarily have to be one. Okay. Now, I know some colleagues in this building would say, hey, let's pick one so we can just focus on one implementation. That's great in theory, but challenging if you want to know who you should be partnering with. So in some cases, we actually take multiple vendors in the exact same space to see what we can learn from one another. Candidly, from what it's worth, even in that situation, some of those vendors even choose to come together and partner and work together. But I will say, when I'm looking at products, I really try to think of it from the standpoint of, let's say it was going to be anything that would be impacting, if I had been a full-time emergency medicine doctor, it's 2:30 in the morning, am I going to use this? It's really cool. But there are 5 people in the lobby and a rig just showed up. If it can't get into workflow, it could be great. It's a function of, if I had a great tool and I'm on a construction site, but I'm going to have to walk half a mile to get it, I'm probably not going to get it. So if I can't find a clear dimension for how a service or technology is going to fit into the workflow, you're done. Mm-hmm. If I'm talking to people who think of workflow as something that can be figured out, not that they're rude, but they treat it kind of like as a trifling detail, you're done. Mm-hmm. For what it is worth, the parties that just intuitively begin with the workflow typically are people who've had to live with the problem. And that's almost certainly going to be a doctor or a nurse. So when I have technologies coming my way that I can clearly see it was a doctor, a nurse, a social worker who was doing the work, a psychologist, a pharmacist, in a very personal way, they can tell me like the following problems were occurring and it had this impact on my life. I'm like, you pretty much got me from hello. Now I'm just hoping that you actually have something that's relevant. And then finally, you're going to start showing me like how this is something that you would have used in your own workflow. Okay. They don't even know it at that point, but you have gotten to the winner's circle possibly. Mm-hmm. And now what are the economics? Can we make the economics work? Now, usually people who have gotten to that point where they've taken the big leap of faith and they've left a huge part of their career, they're usually people who I can trust. And part of what they're looking for within us is that they can trust working with us and we're not going to work them over and that we're going to want to see that their company is going to be successful. There are other healthcare organizations that are doing this kind of work. Remember, I want people to see us as a company that you can effectively joint venture with.
Yeah.
And that means you cannot have a very one-sided relationship. Mm-hmm. And that's why people keep on coming back.
Yep. Because if you as a health system beat down your vendors.
What are you thinking?
Yeah.
I mean, especially if you are joint. What I like about the joint venture model is it immediately starts taking out of like some of the questions that we would have that could be more contentious in the contracting process or in the technology review process. Yes, there are people here who want to protect the organization, but like many organizations, you can protect the organization to a point where you've eliminated risk, but you've also eliminated opportunity. Mm-hmm. When you actually say, wait a minute, we really need to make sure that they benefit from this agreement as well, because we're equity partners with them. It just, the mindset changes almost immediately.
Yeah. Great book that Evidence Care CEO Bo made us read, Speed of Trust.
Yes. Working at the speed of trust is a key component to this.
A few more questions here. So what do you see as your role in innovation across the system as a clinical leader?
This is where I'm going to make comments that I regret. I don't want anyone to ever accuse me of being innovative.
Okay.
And whenever I say that to people, they're like, that's so odd.
I like where you're going with it.
We aren't doing anything that we don't have to do. We are pursuing these areas of clinical care. We are making these partnerships because of the clinical environment that we feel like we are going to have to go into. Mm-hmm. It's going to be disruptive. It's going to be taking on a degree of the unknown. I would rather be viewed as being pragmatic, objective, that we are venturing forward in the changes we have to make in our clinical model, again, because we are adapting to the circumstances around us. Sphere of influence, sphere of control. I rather focus on what we can control and preparing for future, that you've heard me say this multiple times, where we're going to have to achieve desired clinical outcomes without relying on acute care facilities, mm-hmm. as opposed to trying to influence the federal government or payers. And there are people who are trying to do that, and I applaud them for their efforts. It's going to be hard enough, and we're going to need it all the time we can get to for what we feel like we're going to have to accomplish to be positioned to succeed in an MA, MSSPA, ACO environment 3 years from now. I'm going to need all of that time. I could use more time. Mm-hmm. So we're really trying to concentrate on what are the ways in which we want to execute on care. How can we do that effectively? How can we do that reliably? How can we do that without completely disintermediating ourselves, cannibalizing ourselves? Some people are going to say some of the things that we're going to do, especially if they're successful, retrospectively, like, wow, that was really innovative. I would rather say, no, that was really necessary.